Hello, my name is Ramin Nilfoorshan. I'm a consultant psychiatrist for all the adult and dementia specialists working in UK. I'm going to talk about dementia care and the costs related to dementia. The cost related to dementia in UK is around £30 billion per year. Considering the total cost of healthcare in UK is around 150 billion per year, that is a big portion of that cost. But majority of that cost is related to the care of dementia, not to the diagnostic part of dementia care. And a big portion of that dementia care is related to the cost which is for informal carers. When I talk about informal carers, it's about wife, husband, children, neighbors. The current model of dementia care is about assessing the need of the person after they had the diagnosis, and if they need some professional carer, the social service will provide half an hour, once a day, twice a day, or sometimes 4 times a day. And that goes up and up until a moment that the informal carer can't cope with the situation. One of the major issues about this model of care is about the way that we assess the needs of a patient with dementia and their informal carers, the loved one. The issue is we assess the care based on one assessment in their home, and then we continue providing the same amount of care. We know that people with dementia, their needs and their presentation change over time. And therefore, we need to provide care that it matches their need. I'll give you an example. Many of people with dementia, they end up in hospital or care home because they have some sort of infections, or they become irritable, agitated, or aggressive. And majority of the time, people that look after a person with dementia is just trying to deal with the crisis. When a person with dementia have UTI, urinary tract infection, they're not able to go to their GP and talk about their sign or symptoms that they have. For example, they're not able to talk about the symptoms that the other people have. And therefore, it takes much longer for clinician to make a diagnosis. And by the time that the professional are involved to provide cares, it may become too late, and the person with dementia may become delirious and they have to go to hospital. We think the best way to provide care for people with dementia will be to have digital data from them. What it means is people with dementia, we require continuous data coming from their home to some professional centers, and we decide who requires more care or less care. It's so easy by providing a bed mattress, by providing some sensors of how often they go to toilet, how often they use kettle, fridge, the front door, the back door, some biological features like their blood pressure, pulse, and everything else. And bringing everything in a platform in hospital, it will allow professional to see who requires help. And then we will predict who may have some anomaly in the way that they live. For example, if someone is not sleeping well, not eating well, there may be some infection going on or something else. And at that point, we could go and provide better care for them. I think the future of care is about digital care, is about continuous care, and is about providing care when they need it, not just a fixed model of care. Thank you very much.